Good afternoon, everybody. Yes, I'm Joseph Avila. I'm a regional director with Memorial Hermann Health System. I've been here with the organization over 11 years now and started off my career over 24 years ago in the U.S. Navy. So thank you for having me today. Look forward to this quick session and hopefully sharing some of the experiences that we see on a regular basis here in Houston with all of you. So one good thing about Hurricane Beryl is that it came in to Houston with a mission, just to cause chaos, but it moved in fast and it also left fast. So overall, our system did very well. There was no need for us to go on backup energy or backup emergency generators. All of the facilities, we were part of a 12 hospital system. All of them remained with power throughout that period. What we did see, though, as an organization is uptick in carbon monoxide poisoning. Of course, as you know, as you mentioned, so many people were without power. They're using generators. The generators were probably too close to their home or even inside of their homes. And so there was a downstream effect of using these generators. And we started seeing a lot of patients come in with that carbon monoxide poisoning. Great thing though, we are equipped to treat those type of patients. We have a hyperbaric oxygen therapy clinic and to help with the recovery phase. So overall, the system did very well. As an organization, health system, we were already pushing all of our 12 campuses to try to be as compliant as possible. So at least for the flagship hospital here, we had softeners in place, the UV system, the recirculation. And so we have used STU 108 to ensure that even during contingency plans, we remain afloat. We have two huge tanks for reservoirs that if we ever lose water pressure or there's a water incident or event, we're able to still do downtime processes. And so, you know, what does that look like? Well, it's a very slow process. You don't have your washers, you don't have say your sonics sometimes if they're not already connected. And so you're limited to just hand washing. And you know, it goes back to what I said earlier, you know, you're only able to do so much doing all manual processes. And so but at the same time, we're a level 1 trauma hospital. We have it into it where we have to support the community regardless of what event is happening, but even more when there's natural disasters happening. And so we never shut our doors. We're always open 24/7 as a level 1 hospital in Houston. And so we continue to do surgeries. And now those surgeries are not elective, but they're still urgent or emergent type procedures. Well, I mentioned about the communication piece, you know, during the CrowdStrike. We never seen that before. And so losing all communication when that went down and having to only resort to red phones, that really limited our communication within the hospital and then of course within the city. And so as a system, we've been looking for alternative means of communication. We're still trying to find out if there's a product out there that exists, because as we know, during disasters, well, sometimes the towers are affected or everybody ties up the lines. And so we're trying to look for that I guess that walkie-talkie on steroids that is able to communicate, you know, from one hospital that's 30 miles away or 40 miles away, and ensure that we remain in constant communication with one another. Another thing that we learn is bottled wire has expiration dates. You know, we talk about so much expiration dates within our facility with chemical indicators, pill packs, and things of that nature. Well, we were resorting to bottled water so that the the scrub techs are able to do their first hand scrub. And so we didn't realize that bottled water has the expiration date. So something to keep in mind, you know, that the things that you least think about also can impact you or cripple you during these these disasters. And the other thing I was going to talk about, yes, we have contingency plans in place, but that doesn't matter if your staff is not there and able to get in. And so, the plans, the training, they're all good. But if your staff is not able to make it, you have to keep the OR informed, whether, hey, my support is going to be limited to this, or you know what, I'm not able to support you. So those are some of the things that we definitely learned from some of these events here recently. Well, we talk about Amy, and this is a good plug for Amy. It's a starting point. There's no need to try to reinvent the window. We talk about downtime, and part of the downtime is, of course, record keeping, and you have to do all that by hand. And you're probably, well, where do I get that information? Well, I turn to the Amy book, and there goes a handout there, and there's no need for me to recreate something when it's already been done for me. And so that was a huge help. And the other thing, as I mentioned, we're part of a 12 hospital system. So we wanted to make sure that we're standard across all 12 hospitals. And the best thing to do is to make sure that we're all using the same type of forms. Um, Drills, training, those are important. If you constantly train or refresh your team, when events do arise, they'll feel more comfortable and not panic as bad. So I think that that's a critical point. And then, reach out to your network. There's many other people besides me that have gone through these events, and I'm sure that they'll be more than happy to help you out with developing a plan if you don't have a plan, or talk about what helps them out, or where were some of the pain points for them when they went through the last event or disaster.